bright and warm welcome to guests, delegates, and every participant present today, although virtually. I, Dr. Nabila Kazi, from the Department of Dentistry, Symbiosis Medical College for Women, and Symbiosis University Hospital and Research Center, welcome you to SYMHEALTH 2021, a national conference on approach to interdisciplinary healthcare, as we celebrate 50 glorious years of excellence in education at Symbiosis. I hope you all are ready with your charged mobiles and laptops and 5 GB per day high-speed internet for this 2-day-long yet engaging conference. For the very obvious and now rapid rising reason of COVID-19, it is for the first time in 20 years that we are hosting SYMHEALTH as a virtual conference. However, we hope that you enjoy this conference with just as much zeal and zest as we have embodied while organizing it for you. The idea is to always stay positive and test negative. Vasudhaiva Kutumbakam. The world is one family. Our motto at Symbiosis is clearly seen in the cultural diversity we harbor amongst the 40,000 plus students, faculty here, under the able leadership and guidance of Honorable Professor S.B. Muzumdar Sir. In consonance with transformative forces of globalization and knowledge explosion, Symbiosis School for Open and Distance Learning, a department under Symbiosis International University, has organized SYMHEALTH 2021 to reflect our belief that in order to facilitate available, affordable, and accessible healthcare delivery, one needs to stay abreast with developments in other disciplines in this very well-connected and knowledgeable world. The pandemic has emphasized the importance of each and every partner of the healthcare delivery system. The various verticals of healthcare are inextricably interlinked with each other. When we stand united and work as a team, we can transform this moment into a catalyst for unity and bring about a positive change in the healthcare scenario of our country. We promise you 2 days filled with new hopes for a new beginning. Hence, I wish you all a productive and fulfilling experience at SYMHEALTH 2021. Warren Bennis wisely said, leadership is the capacity to translate vision into reality. Let me begin by introducing our charismatic leaders at Symbiosis. We welcome our esteemed dignitaries on this virtual platform. Our chief guest for the day, Dr. Harsh Mahajan Sir, President of NATHEALTH, Dr. Rajni Gupte Madam, Vice Chancellor, Symbiosis International Deemed University, Dr. Vidya Yerodekar Madam, Principal Director, Symbiosis Society and Pro-Chancellor, Symbiosis International University, Dr. Rajiv Yerodekar Sir, Dean, Faculty of Health Sciences, Symbiosis International University, Dr. Abhay Saraf Sir, Director, Symbiosis School for Open and Distance Learning, Dr. Samita Zadav Madam, Professor and Deputy Director, Symbiosis Institute of Health Sciences, Symbiosis International University. SYMHEALTH 2021 offers unique opportunities to experience cutting-edge technology and innovative blends of ideas. It is a melting pot for global multidisciplinary healthcare cultures coming together, sharing a concern and passion for improving quality and safe healthcare delivery. We have with us today Dr. Abhay Saraf Sir, Director, Symbiosis School for Open and Distance Learning, Symbiosis International University. Dr. Saraf has 32 years experience of public health program management, capacity building, technical assistance in India with government, WHO, UNICEF, PATH, Public Health Foundation of India, IQVIA, in various leadership positions. He has developed and launched more than 10 distance education programs in various domains. He has also successfully led planning and implementation of nationwide certificate course on evidence-based diabetes management, gestational diabetes mellitus, contraception in clinical practice, and immunization practice covering more than 20 states, 80 cities, and facilitated training of around 8,000 members across entire country in partnership with FOXI, IAP, CHF, UNICEF, and going on. Dr. Saraf has also led numerous projects with various state governments and international organizations and academic institutions. May I request Dr. Abhay Saraf Sir to deliver the welcome address.
Good morning. On behalf of Symbiosis School for Open and Distance Learning, a constituent of Symbiosis International University, I heartily welcome all the esteemed dignitaries, our chief guest for the function, Dr. Harsh Mahajan, President NATHEALTH, our mentors and guide, Honorable Dr. S.B. Muzumdar Sir, Chancellor of SIU, Dr. Vidya Yeravadekar, Pro-Chancellor of our university and Principal Director of Symbiosis, Dr. Rajani Gupte, Vice Chancellor of our university, and Dr. Rajiv Yeravadekar, our ever-dynamic Dean of Faculty of Health Sciences. It is also my privilege to welcome members of the Managing Committee, Board of Management, Deans of all faculties, Directors of the institutes, Heads of the department, faculty members, speakers, and my fellow colleagues. And most importantly, my dear participants, welcome to you all. This mega event, SYMHEALTH 2021, a national conference on interdisciplinary approach to healthcare, has a legacy of more than 2 decades. And generally around 1,500 delegates from all verticals of healthcare mark their attendance every year for this event. We would have very much loved to host you all at our beautiful campus, but on account of the pandemic and to support the tireless efforts of frontline workers, we must put ours and the larger society's safety first, and thus we are conducting this event online. Majority of the conference participants today are mid-career healthcare professionals from medical college, public and private health system, including hospitals, armed forces, medical tourism, clinical research, health insurance, and clinical research industry and academia. They are working as doctors, nurses, teachers, hospital administrators, clinicians, and allied health professionals, and they are all engaged in fighting this COVID-19 pandemic. To these Corona warriors, let me compliment and sincerely thank you all for risking your lives to keep the community and patients safe. Appreciate you all joining this event by taking out time from your busy healthcare-related duties. We are all greatly indebted to you for your commitment, guidance, and efforts. The priority during this COVID-19 pandemic, which is an unprecedented and probably once-in-a-lifetime event for each one of us, has been by crisis response, emphasizing health and safety, maintaining and augmenting essential services, and the visualization, most important, of work and education. The major lessons in today's COVID era is to learn to deal with this present situation, to manage the continuity of learning and emerging stronger, and finally prepare ourselves for shaping the new normal. Not canceling this event, despite numerous challenges, and conducting it online is a deliberate effort in that direction. I must take this opportunity to also appreciate that despite your hard commitments, challenges, and extra busy schedules, you have taken out time and joined with us. We know that India's healthcare challenges are unique and complex, and they tend to offer diverse career opportunities. With the emphasis on universal health coverage and control of the pandemic, the current challenge is to strengthen health infrastructure and empower and augment the human resources for health. As an opportunity to continue our learning and gain more valuable insights into this dynamic healthcare sector, this SYMHEALTH 2021, today's event, promises to act as an ocean to quench your thirst for knowledge. Against this background, a galaxy of stalwarts from academia, industry, policy, research, patient care, and quality and management domains are slated to deliver sessions during these 2 days on contemporary and critical issues. As we move forward in this conference, I wish you all a fruitful and worthwhile experience. It has been an honor to be amongst this august gathering and to be able to welcome you. Thank you very much.
Thank you, sir. Moving forward, a few words about Dr. Rajiv Yeravadekar, sir, our enterprising Dean of the Faculty of Health Sciences, an alumnus of the prestigious BJ Medical College, a gold medalist in his Masters in Obstetrics and Gynecology With a PhD under the Faculty of Management, Dr. Rajiv Yerudekar has been the driving force behind the conceptualization and establishment of the Faculty of Health and Biomedical Sciences here at Symbiosis International University. Sir's commendable work at the Sultanate of Oman and membership in various governmental and organizations is held in high regards. Currently, the Dean of the Faculty of Health and Biological Sciences, SIU, Dr. Rajiv's core area of research is public health with special focus on health promotion. Sir has contributed a number of articles in various national and international journals. Dr. Rajiv has been a member of various governmental bodies like Maharashtra Medical Council, Maharashtra Nursing Council, and Board of Governors of the erstwhile Medical Council of India. Dr. Rajiv is the lead architect in the design, development, launch, and propagation of the Health Promoting University initiative in our country. May I request Dr. Rajiv Yerudekar, sir, to address the audience.
Well, good morning. Nabila, thanks for that kind introduction and the words of praise. It's indeed nice to hear someone praise you, but at the same time, a little embarrassing. But I take this opportunity to welcome everyone. Honorable Chancellor, Sir, Dr. Muzumdar, President and Founder Director of Symbiosis, Dr. Vidya Yerudekar, the Pro-Chancellor, Dr. Rajni Gupte, the Vice-Chancellor, faculty members of the Faculty of Health Sciences, the students of the various programs under Symbiosis School of Open and Distance Learning in the broad disciplines of healthcare management, medico-legal systems, clinical research, nutrition and dietetics, nursing, and some new programs, innovative programs, which have been the need of the hour and which have dictated the commissioning of such programs, notable among which is the program in health communication and the one to be launched soon, one on digital health professionals. And the chief guest of today's function, Dr. Harsh. All what I can say, Harsh, thank you very much for having joined the proceedings of this two-day national mega event, rather international event, because we do have students from overseas. And for the audience on this platform, Dr. Harsh Mahajan his biodata will be read out, the official ones. But for me and for everyone at Symbiosis, he's family. He's just a phone call away as president of NATHEALTH, as the former president of the Indian Radiological Association, as my colleague member on the National Board for Effective Implementation of the PCP entity, the National Supervisory Board. There have been numerous occasions where I've had a chance not only to interact, but also to learn extensively from Dr. Harsh Mahajan and his more than able or equally able son, Dr. Vidur Mahajan, who helps him run the show at the Harsh Mahajan Center in Delhi. And the important fact is that his thrust and focus is not only on the services that are provided, but also into academics and training, more of which I shall come subsequently. Well, friends, let me start off by saying, or rather acknowledging, that the film you saw was a 2017 one. So in a way, it's a little outdated and it does not mention the galloping strides of development at the Symbiosis International University, more so at the Faculty of Health Sciences. It does not talk about the establishment of Symbiosis School of Culinary Arts, one of the constituents. It does not talk about the establishment of Symbiosis Center for Health Skills, a dedicated multidisciplinary center meant to develop health skills, both in the clinical and non-clinical domain, across the various disciplines, various cadres of healthcare professionals, right from the super specialists, specialists, general practitioners to the ward boys and the other menial staff. It does not talk about an iconic, monumental, landmark event in the history of the 50 years of the legacy which Nabila spoke of the Symbiosis International University, namely the commissioning of the Symbiosis Medical College for Women and the Symbiosis University Hospital and Research Center. And I reiterate the thrust and focus on the University Hospital being a center for research and training, in addition to providing quality health and affordable healthcare services. But for you students of the Symbiosis School of Open and Distance Learning, it does not make a mention of the establishment of the Symbiosis School of Open and Distance Learning as a formal constituent of the Symbiosis International University, which was erstwhile carried out as an autonomous institute under the Symbiosis Society. But given the status the Symbiosis International University enjoys and the NAC A grade, we ventured to establish a dedicated school of open and distance learning under the aegis of the Symbiosis International University. And this is one of the occasions where we have under the umbrella of the Symbiosis International University. Well, it is not customary for the dean to propose a vote of thanks, rather appreciate the in-house staff. But the vote of thanks is conventionally given at the end of an event. And by that time, the audience is busy packing their bags with no due recognition and credit given to the staff and the people who have worked both off the screen and off the screen behind, both on the screen and off the screen behind the curtains to make this event a great success. And at this juncture, I would heartily like to acknowledge the phenomenal work put up by Team Dr. Saraf at the SSODL and the IT staff, including the offices of the SIU, in making this virtual event possible. I say so on behalf of two occasions, for two reasons, amongst others. Number one, 6 of our staff members at the Symbiosis School of Open and Distance Learning have tested positive for corona. Notwithstanding, rising to the occasion, coming to the call of exigencies of duty, they are still participating in this virtual event. Faculty members of the Symbiosis Institute of Health Sciences, I won't take individual names, have got domestic difficulties besides the fact that they have got distances to travel, and you all are aware of the not so good conditions prevalent in Maharashtra, particularly in Pune. And therefore, even a simple thing like traveling from home to the university campus is a big challenge. And I really appreciate the fantastic work put in by the entire SIU staff, including the SSODL, in making this event possible. To me, they are no less than Corona warriors. Dr. Sarafi spoke of the frontline Corona warriors. Yes, I do appreciate the frontline Corona workers, Dr. Natarajan and Dr. Ratra at the SUHRC doing fantastic work. But as academic representatives, your team, hats off to the wonderful event they have managed to conceptualize and implement, challenges notwithstanding. Well, the interdisciplinary approach to healthcare has been a theme and a feature of the SYMHEALTH initiative for the last 22 years. And we do not want healthcare professionals, forget doctors and nurses, the entire gamut and spectrum of the allied healthcare workers exemplified by this bill of 2019, which is being tabled right now in the parliament, of raising a kind of healthcare professionals beyond doctors and beyond nurses, beyond medics, paramedics, beyond pharmacists, beyond public health professionals. We need a million hands, and the corona pandemic has amply demonstrated how the public healthcare system in India or globally is in a lamentable and a fractured state, crying for attention by policymakers to allocate more resources. And when I say resources, it is not only the funds, but it also includes allocation of priorities to the healthcare sector. The COVID-19, as I said and I do say in various occasions, has exposed a world of VUCA. V for volatility, U for uncertainty, C for complexity, and A for ambiguity. We are not sure at all of what is going to happen tomorrow. And I said to one of my friends, speakers from overseas, I said, God alone knows when this corona fear and the corona problems are going to rise out and we're going to have a new normal. He said, Rajiv, in our country, now we have stopped saying God knows. We say that the devil and the demons in the deep sea only know when the corona effect is going to go on. That is the uncertainty. That is the ambiguity. That is the state of helplessness in which we are all today. And that has impacted, besides other sectors of the economy, most importantly, the healthcare sector. And within the healthcare sector, when I say healthcare, it is not only the services, but it also includes the education and the training part. And as an academic institute of the state of a university, at SIU, the challenges have been to provide this training and teaching, the teaching and training supplemented by online learning, online teaching, which imposes its own challenges. Not only are the teachers not trained in online education, they are trained in the conventional chalk and talk methodology of teaching, the pedagogy of teaching. It is also the ability and the receptivity of students to adapt to this online modality of training, teaching, and again, what we as healthcare professionals and more so in the clinical domain talk about a haptic feel. That is something which is missing, where we do not have live contact with patients or healthcare teaching pedagogies. The expectations of patients have changed. They no longer want to visit the hospitals. They believe in teleconsultation, and that's the role of telemedicine, which is going to be highlighted. And I'll come to that in a few moments from now. The requirements of the healthcare managers has changed. There's a need to raise a cadre of digital healthcare professionals, and I'm sure Dr. Uma Nambiar, who's going to be speaking as president of National Digital Health Association of India, is going to amply highlight the role of academia or hospitals in raising this new generation or breed of digitally qualified healthcare professionals, because we are not formally trained. As simple as that. We need to understand the importance of public health. We need to understand emerging technologies like Internet of Medical Technology, the emerging role of diagnostics, which Harsh is going to amply demonstrate, the established role of applied artificial intelligence, which Avik is going to talk about, and the need for research and development, as whether it's in any other things, most typified by the emerging role of vaccines. Today there's one vaccine, tomorrow there's another vaccine. Today this drug remdesivir was or is a gold standard, but tomorrow it's under a cloud about the efficacy. And I don't even want to talk about the other complex drugs, tongue twisters, tocilizumab, which is there, and a host of other drugs. What is the role of ivermectin? But I don't want to get into these technicalities. I need to get to the table that here we have to put up a symbiotic, congruent and a confluent approach from amongst all healthcare professionals. Because if you see the Health Setu app, it talks about not only the medications under the Ministry of Ayush, but it also talks of an integrated approach. What diet to take, what exercise to do, what other sources of healthcare, simple thing like pranayam, yoga, which can help recoup. And in this emerging snowball cascading event of things which happening, one thing which emerges as the common denominator is but which is not talked about very openly. And I'm glad Symbiosis International University has taken the lead. Just a couple of days back, Dr. Girija Mahale from the Symbiosis Center for Emotional Wellbeing organized a very important international webinar on the mental health of students and staff on communities, and spreading the message from communities, from university campuses to communities. And the panel discussions which we had highlighted, yes, the fact that mental health is an area of serious concern of students, of healthcare professionals everywhere. Today's and tomorrow's events, opening batsman Harsh Mahajan, subsequently Uma, Dr. Praveen Gedam from the National Health Authority talking about Ayushman Bharat, Avik talking about applied artificial intelligence. And the fundamental and the beauty is within the Symbiosis ecosystem, we've got an entire, a plethora of healthcare professionals. And whether it's Dr. Natarajan as the CEO who's going to talk about the leadership in hospitals, leadership challenges, whether Dr. Ratra is going to be talking about quality accreditation, whether it's Dr. Rupashri who's going to be talking about the emerging role of telemedicine, Dr. Ruchi Jaggi, who's the Dean of the Faculty of Media and Communication, Dr. Girija from Symbiosis Center for Emotional Wellbeing. Unfortunately, Dr. Ketan Kotecha, the Dean of the Faculty of Engineering, who's an expert in artificial intelligence and who heads the Center for Applied Artificial Intelligence at SIU, would not be participating because he's down with COVID. And Dr. Sanjay Gupte, I mean, there's a galaxy of eminent speakers, all wanting to not only douse you with information, but get to the table what the healthcare is today, what is it going to behold tomorrow. And as academia and as people committed to professional upgradation, congratulations to you students who have invested in time, energy, and resources to enroll for these distance education programs and committed your time, energies, and efforts to sharpen your axe, so as to say, and learn from the stalwarts, understanding what you would be required to be practicing in years to come. I welcome all of you to this two-day event, and I'm sure you'll have a delightful learning experience and will be left craving for more, which the Symbiosis School of Open and Distance Learning would be happy to provide you as a continuous online support. From today onwards, rather from tomorrow onwards, you would be alumni of the prestigious Symbiosis International University. Welcome aboard, welcome as family to the Symbiosis International University. Thank you and have a great 2 days of learning, and stay connected. Stay home, stay safe, stay connected. Thank you.
Thank you so much, sir, for always adding the informal and familial touch to our esteemed chief guests. We look forward to growing under your able guidance. Moving on to a few words about Dr. Vidya Yerodekar, Madam, the Principal Director of Symbiosis Society and Pro-Chancellor, Symbiosis International University. Dr. Vidya Yerodekar, Madam, holds a postgraduate degree in medicine, a degree in law, and PhD in internationalization of higher education in India. Madam has been instrumental in bringing in innovative approaches to promote internationalization. Sharing her father's vision for capacity building, she strives to create a home away from home by creating a conducive environment for international students. Dr. Vidya has been a member of many government and non-government organizations, including the University Grants Commission Central, Advisory Board of Education, Indian Council for Cultural Relations, an expert group on global outreach of higher education, to name a few. Madam has been ranked amongst India's top 25 powerful women by Fame India magazine. Dr. Vidya's hard work has won her numerous awards and accolades, and she is now focused on making Symbiosis International University benchmark amongst one of the best universities in Asia. I request Dr. Vidya Yerodekar, Madam, to address the gathering.
Thank you, Nabila, and I welcome all the delegates who have come here and joined virtually the SYMHEALTH conference. Dr. Rajiv Yerodekar, the Dean of the Faculty of Health Sciences, Dr. Rajni Gupte, my colleague and the Vice Chancellor of the University, Dr. Harsh Mahajan, the Chief Guest for this function, Dr. Abhay Saraf, Dr. Samita Zada, Team SIHS and Team Faculty of Health Sciences, our Chancellor, Dr. S.B. Muzumdar, sir, who also wanted to watch the inaugural, though his and my role is tomorrow, and all the wonderful people who have joined us digitally. Let me first welcome you on behalf of the Symbiosis International University and the Faculty of Health Sciences. As Dr. Rajiv very rightly said, that we must applaud the efforts of everyone, every academic and non-academic person under the Faculty of Health Sciences, and more specifically, Dr. Abhay Saraf's team. In fact, he hardly has a team, I would say, because most of them have been COVID positive, and it was really, really a challenge for him to manage. And I could listen to the phone calls that he made to Dr. Rajiv, and somehow got this conference going. So kudos to you, Dr. Saraf, and all of the other members who have supported you. I just wanted to say a few words at the opening of this conference, because the whole Biradari over here is or are members of the healthcare fraternity, or would be members of the healthcare fraternity. And I think the utmost importance to the healthcare fraternity, to which I also belong. I am a gynecologist by training, but don't practice gynec and obstetrics anymore. But yes, I do deliver institutions every year of Symbiosis. But this is my fraternity, and I feel so connected. And as I said, that this is a hard time for all of us, but more importantly, it is also an important time for all of us, because the what we have learned in medicine, we are actually implementing. We all did private practice, looked at patients, treated patients with great passion as well as compassion. But today is a time where we are actually doing service, not just to our patients, but to the country, and not just to the country, but the world at large. And therefore, I really want to acknowledge the efforts of each and every person here, and even those who are not here, who have contributed by giving their best services in treating COVID patients. Our hospital, the Symbiosis University Hospital, I won't talk much about it because it has already been mentioned by Dr. Rajiv and others, has been doing phenomenal work. Dr. Vijay Natarajan and his team are doing phenomenal work, and we can see how hard they work and how they work with passion and compassion, that the messages that I get from people in Pune city who have been admitted or who get discharged are only words saying a big thank you. And in that thank you, they keep saying that your doctors have not just supported us physically, but more important, mentally. And that's what I would just spend a few minutes talking about. I think it's so imperative that in these times of pandemic, you see that the mental health of each and every individual has gone for a toss. And I think as healthcare professionals, for us, not just to provide the medical services, but to provide the mental health care services to our patients has become of paramount importance. Even in the program that I see, which has been chalked out for today and tomorrow, there are two words that come out, very strongly. One is digital, and the second is mental, and that is what is, it is all about. Whether it's imparting education digitally, and we know, Dr. Gupta and I know the challenges that we went through in 2020, and how seamlessly our faculty and students have adapted to this mode and delivery and pedagogy of education, a digital education that we've been providing them since the last March of 2020. Likewise, digital healthcare, which I'm sure experts are going to talk about, and I'm no expert to discuss, but how seamlessly our patients have adapted to this digital healthcare, how seamlessly telehealth, which was once just a theoretical subject, which we probably just read in the newspapers and read about, some foreign countries practicing this, but how well it has been practiced in our country, even in the remotest of places. I mean, doctors hardly see any patients nowadays. It's more of telemedicine, because they are all now dedicating themselves to the treatment of COVID patients. And therefore, most of the non-COVID treatment is through telemedicine. So digital is the mantra during this pandemic. And so is mental health. The second word that, is of great importance is mental health. Whether it's small children, I really, I admire the teachers of kindergarten, where my grandkids are in front of the screen for almost 1.5 hours every day. And to keep them engaged online, I cannot imagine how they would do it. So it is really, become such a big, problem, not, I wouldn't say problem, but a challenge, both for teachers as well as students, to adapt to this on-screen education. And therefore, the challenges of mental health leading from this on-screen education. Students don't get to meet their peers. They can't come to colleges and university campuses. They're confined to their homes. Many a times they're not used to having parents around them for more than 24 hours nowadays. And parents are not used to having their kids along with them. And therefore, the issues and the conflicts that arise in families leading to mental health problems. And of course, the stress of imparting healthcare services for doctors and nurses, which has become another challenge. I mean, when you see the doctors working for more than 18 hours a day, the nurses are the backbone of our healthcare system, again working for more than 18 to 20 hours a day. Definitely, not only the physical health is going to be affected, but the mental health. And I'm so very happy that Symbiosis took the initiative of setting up the Symbiosis Center for Emotional Wellbeing, a dedicated department that provides counseling to all our students and staff, and to anybody who requires this kind of support for mental health issues. Just recently, we had a 2 days wonderful conference, and there was so much spoken about the importance of mental health, for everybody, especially during these times of the pandemic. And I'm very, very happy that Dr. Saraf has, emphasized the importance in these 2 days on these two major issues. Of course, apart from that, we do have the deliberations on medico-legal systems, on nutrition and dietetics, and of course, clinical research, which is again of utmost importance. I just wanted to acknowledge the efforts of each and every person who's here as a participant in this conference for all that they have done to the healthcare system of our country. All that I wanted to say, I have said. Dr. Saraf, I will give a speech tomorrow at the Golden Jubilee Lecture Series when Dr. Devi Shetty would be addressing all the students and all the delegates. Thank you very much.
A leader is one who knows the way, goes the way, and shows the way. Thank you, ma'am, for always being our strongest pillar of support You inspire us every day. Moving on, it is indeed a privilege to have amongst us today Dr. Rajni Gupte, Madam, the Vice Chancellor, Symbiosis International University. A distinguished academician, Dr. Rajni received her doctorate degree in economics from the prestigious Gokhale Institute of Economics and Politics, Pune. She joined Symbiosis as a founding member of the Symbiosis Institute of International Business in 1992. Her headship led the institute to be established as one of the top-ranking business schools in India. A capable institution builder, Dr. Gupte has also earlier held the positions of Dean, Faculty of Management, Dean Academics, and Pro-Vice Chancellor at the Symbiosis International University. Madam has been actively engaged with higher education for over 30 years, both as a professor and researcher, and has taught at many foreign universities like the Oakland University, Michigan University, and Bremen University for Applied Sciences in Germany. For her valuable contribution in the field of education, Dr. Gupte has been awarded the Think Pure Award, the Iconic Leader Award for creating a better world for all at the Women Economic Forum 2019, and a Visionary Leader of India for being an institution builder at the hands of Sri Pranab Mukherjee, former President of India. I kindly request Dr. Rajni Gupte, Madam, to address the gathering.
Respected Dr. S.B. Muzumdar, the Chancellor of the Symbiosis International University, Dr. Vidya Yarudekar, the Pro-Chancellor of the Symbiosis International University, our chief guest this morning, Dr. Harsh Mahajan, President NATHEALTH, the Healthcare Federation of India, Dr. Rajiv Yarudekar, the Dean of the Faculty of Health Sciences, Dr. Saraf, the Director of SSODL, all the faculty, staff, students, invited speakers, dignitaries. I extend a very warm welcome to each one of you from the Symbiosis International University. This annual conference draws a huge audience each year and provides everyone an opportunity to listen to diverse topics from eminent speakers. I know, Dr. Mahajan, you must be an extremely busy person today, so I'm going to keep it very, very brief. The topic for the conference is Interdisciplinary Approach to Healthcare. And over here, in the context of interdisciplinarity, I would mention only 2 points. One, I think the task of all healthcare professionals is to keep the patient at the center of the healthcare. When I say this, what I really mean is that to treat a patient, all disciplines in the hospital, all the relevant disciplines within the hospitals need to come together. Teams of specialists from different specializations, including a general physician, a pharmacist, and related specialists, need to look at the patient as one unit. And I think this would go a long way in bringing together the specialists from different fields to solve one unique problem. Very often we hear nowadays of doctors who are super specialized. In fact, I was talking about a friend of mine who specializes in shoulders. So when I mentioned this to another friend of mine, he said, is it the right shoulder or the left shoulder? Now, this is, of course, not something to be laughed and joked about, but truly, when you look at it, you realize that this super specialization ends up in compartmentalizing the knowledge of the person. And when all such specialists can get together and look at the patient as one unit and solve his problem jointly, I do think interdisciplinarity in this context would serve the purpose of the patient truly. The second way in which I look at interdisciplinarity, of course, is what the conference has been doing year after year, is bringing in insights from other unrelated disciplines to support the healthcare. All of us read about AI, machine learning, and how data arising from healthcare can be looked at. We also know that every year we have a session on law in healthcare, medical legal problems. Definitely something that doctors should know about. The application of IT in healthcare is again often spoken about. So is technology in health tech. But I do feel that it's equally important in education of health and for professionals in the healthcare sector to focus on soft skills, on psychology, things from management, for instance, motivation theories, conflict resolution, how to build teams, how well to communicate. All of this is something that healthcare professionals need to spend an immense amount of time on, because eventually, as Dr. Vidya ma'am mentioned, mental health does play a very critical role. And I think a lot of it can be resolved by an understanding of how to deal with patients, understanding of psychology of the patient, and keeping, as I said in the beginning, the patient at the center of your care. Once that is done, I think interdisciplinarity will yield excellent results. I will not take much time. I know we are all eager to listen to Dr. Mahajan. So I wish the conference all success. Thank you so much, Dr. Saraf, for inviting me for this session. Thank you.
Thank you, madam, for your wise words, and we look forward to augment your thoughts into our everyday lives. Moving forward to a formal introduction for our chief guest for the day, Padma Shri Dr. Harsh Mahajan, sir, President of NATHEALTH, Healthcare Federation of India, New Delhi. Dr. Mahajan is an Indian radiologist and one of the pioneers of imaging technology in India. Sir is the founder of Mahajan Imaging, a diagnostic imaging center in the Indian capital of New Delhi, a former president of the Indian Radiological and Imaging Association, IRIA, and the director of the Department of Nuclear Medicine and Bone Densitometry at the Sir Ganga Ram Hospital. Dr. Mahajan has served as the honorary radiologist to the President of India and as the honorary consultant to the International Atomic Energy Agency. He is on the board of advisors of Rishi Hood University. Sir has published several articles on clinical radiology and other medical topics. The government of India awarded him the fourth highest civilian honor of the Padma Shri in 2002. In 2021, Sir took charge as the NATHEALTH president, a body representing the entire ecosystem of the Indian healthcare industry, comprising healthcare services, medical technology, diagnostics, health, insurance, etc. Welcome, sir. Diagnostics is playing a significant role in shaping the transformation of the healthcare industry from volume-based to value-based care, where not only is care organized around the needs of the patient, but also allows healthcare providers to deliver measurable value and outcomes at lower costs. I take this opportunity to welcome our chief guest, Dr. Harsh Mahajan, sir, once again, and leave the stage open for him to get the ball rolling with his address on emerging role of diagnostics in healthcare sector, opportunities and challenges. So, all over to you.
Thank you very much, Professor Dr. S.P. Mazumdar, Dr. Vidya Yeravedkar, Dr. Rajiv Yeravedkar, Dr. Rajani Gupte, Dr. Abhay Saraf, Dr. Samita Yadav, all the other dignitaries present here, ladies and gentlemen. It is indeed a singular honor for me, apart from being a pleasure, to be present in this inaugural ceremony as the chief guest, SYMHEALTH 2021, organized by the Symbiosis School for Open and Distance Learning. Diagnostics, as we all know, has really come into its own over the last 3 decades. And today, nothing moves without a diagnosis. We are in the era of evidence-based medicine, and treating doctors, patients, citizenry at large, they don't want you shooting in the dark. It's unlike the days when we were young, when we would be given a mixture, a red mixture or a green mixture in a bottle, and we trusted what it contained. We didn't know what it contained. It was generally a mixture of 3-4 medicines. And somehow we got well. Probably the diseases at that time were not so great, so bad as what we have today. Probably we trusted more our physician, who were not super specialists, not even specialists. And we got well, or so we thought we got well. But just remember that at the time of independence, the life expectancy was 36 years. And so if someone became 40, 45 years, he would sit at home and be considered old. Today, as you know, they say 60 is when you get young. Before that, you're a child. And everyone lives to 90. The life expectancy is 70 plus. And so something has happened, something has been done, something has technologically changed, which has made us achieve this goal. And the goal is much higher, that despite the pollution that we have, despite the new diseases, both communicable and non-communicable, that we are able to live longer, live healthier, have better quality of life. And apart from therapeutic interventions, treatments, both surgical and non-surgical, medicinal, new drugs, the one area which has undergone a sea change is diagnostics. And nothing brought it home more clearly than this COVID pandemic, when the WHO boss said, test, test, test. And if only you do that, will you be able to diagnose early? Will you be able to actually isolate these people and separate them from not spreading the disease, and be able to somehow control the pandemic? And we did that very well. India, from being able to do about 100 RT-PCR tests in the beginning of the pandemic in April last year, today is capable of doing 1.6 million a day. What a rapid transformation, which shows how the medical industry, how the hospitals, how the diagnostic centers, how the labs, how the manufacturers of diagnostic kits and tests rose to the occasion, that we were able to meet this challenge. But now it seems even that was not adequate, because somehow we were all lulled into a false sense of security. We became complacent as the number of cases went down. And in January, February, and even beginning of March, it seemed the pandemic was over. But we forgot the lessons of history. We forgot that the first wave is always followed by a second wave which is much worse than the first. And we saw it in the West, and somehow we felt complacent. In fact, many in the political class even gloated over the fact that we were doing so well. Even the vaccination started on the 16th of January. And we looked at the West and said, they have such tremendous healthcare systems, and look how they are failing. That was a wrong thought, and we are paying the price for it. And now, when the same RT-PCR tests, which by and large we were able to turn around in 24 to 48 hours, now when it's taking 5 days, we realize the futility of testing if the turnaround times are not fast enough. Because what is the use of getting a report on the 5th day or the 6th day in a contagious disease? And we actually realize the importance of testing, the importance of having the capacity to test more and more given the situation, and the importance of turnaround times. So nothing could have brought home the importance of diagnostics, because without that, how do you treat? And the same we saw in the last 2 to 3 decades, especially in the field of radiology and imaging, as well as in the field of pathology, biochemistry, and microbiology, where now in this era of evidence-based medicine, no doctor can treat without knowing what he or she is treating, what is the disease. Treatment is not based on symptoms and clinical findings alone. You need a paraphernalia of tests. And even if a doctor in his wisdom wants to do it, we have the Damocles sword of the Consumer Act hanging on us, where anyone is free to go to the consumer court against a doctor, against a hospital system, and say that because testing was not done, or because the right test was not done, a correct diagnosis was not made, and that's why the patient suffered. And so we've seen the erosion over the years, especially in the younger lot who are getting trained, who are completely dependent on tests, on diagnostics, high-end diagnostics. And this may be one of the shortcomings or one of the cons of increased diagnostics. But then this has also got many pros, the advantages. And let me delve into those. Some which are very, very obvious and some which are not. Radiology and imaging, and I'm a practicing radiologist. We have 10 radiology centers. We are present as standalone centers in Delhi and in the NCR region, where we do everything from X-ray to PET-CT. We are also present within private hospitals. We run the nuclear medicine and PET-CT department of the famous Gangaram Hospital for the last 21 years. We are present in Fortis. We are present in several other hospitals. We are also present in the Safdarjung Hospital, a huge government hospital of Delhi, where we, in a public-private partnership, we run the radiology services in the sports injury center there, MRI, CT, X-ray, and so on and so forth. And what I bring to you is my experience of the last 30 years or so, being in the private sector, doing imaging, and also we have a research division, which is called CARING, the Center for Advanced Research in Imaging, Neurosciences, and Genomics, under which we have North India's best, we believe, genomics lab, where we do cancer genomics, and now we can also actually repurpose it to start doing whole genome sequencing for the coronavirus, to know what are the mutations, how this virus is changing its shape, its abilities, how it's kind of so clever that it's able to stay ahead of whatever we may do. And we know the mutations are making a huge difference. And we see in Maharashtra, where probably the so-called double mutant virus is wreaking havoc. And in North India, especially in Punjab, we have the UK variant. How do you come to know these? RT-PCR alone can just tell you whether you have COVID or you do not. But what type of virus has affected you can only be known by whole genome sequencing, which the WHO says and the Indian government says 5% of all positive samples should undergo genomic sequencing. In England, they are doing 10% of all positive samples. And that's how they are able to know which is the particular variant which is there and how geographically it's spreading, not only within England, but in other parts of the world. Corona has taught us very quickly that the world is one. Corona doesn't know any boundaries, geographical, political, or otherwise. And unless we use these high-end tests, how will we know that from Maharashtra, from Pune, has the double mutant traveled to Delhi, and is that responsible for the huge surge we are seeing and a positivity rate of 36% and nearly 30,000 positives every day? Or it is the UK variant which has come from UK into Punjab and then into Delhi and other parts of the country? Or is it the South African variant? Indians are avid travelers and NRIs are all over, and we travel to and fro. And even from Brazil, it has been found that we have a variant. So whole genome sequencing is not only for cancer, it is not only to determine the hereditary risk of cancer, it is also to determine the hereditary risk for heart disease, for Alzheimer's, for looking at the unborn neonate, the unborn fetus, that will this have certain genetic abnormalities which the mother or father or both may be carrying. So one huge sunrise area of diagnostics is genomics. And we know that personally because we practice that on a daily basis. And in our genomics lab, the smallest machine that we had was the RT-PCR machine. And when COVID hit us, you know, our consultants said, let's start doing RT-PCR. And very quickly, we were already NABL accredited for genomic testing. And very quickly, in June, we were able to start RT-PCR. And RT-PCR now, as you know, it's also a molecular test and was very sparsely used in the past. But today, we need millions and millions, and it has come. Everyone, every citizen of this country knows RT-PCR now, which probably even the physicians a year ago, very few of them knew. The other area I want to talk about is artificial intelligence. And artificial intelligence is again something which we do. The first paper that was published in the Lancet in 2018 on artificial intelligence was published by us along with our collaborators who are in Mumbai, Cure AI. And this is again an area which is going to transform medicine. Computers being able to read scans, computers being able to read pathology slides, computers being able to tell the treating clinician, the treating cancer physician, the treating surgeon as to what to do, how to do it, and how precisely to do it is where the future is. So we talk of predictive medicine and precision medicine. And these are all going to be helped by imaging, by genomics, by telepathology, teleradiology, and the new field, which I believe, I've been saying it for 7 years now, the new field of diagnostics, which will be the field of integrated diagnostics, where you cannot expect a physician sitting in his OPD to look at 20 different kinds of tests and make sense of them. You have imaging, you have PET CT, MRI, CT scan, X-ray, ultrasound, you have genomics, you have biochemistry, you have microbiology, you have pathology, you have clinical features. And that I would like to tell the young students who are hearing, the clinical features still remain preeminent. A CT scan which shows an abnormality, I may wrongly diagnose as cancer if I don't know the clinical. So the clinical features still remain preeminent. And this is what the new diagnostician, for lack of a better word, the integrated diagnostics expert will have to actually chew all of this and make sense of it. And even for him or her, it's not easy. He would need artificial intelligence tools which would be able to digest, the huge gigabytes of data. And then it would be the human being who would be able to put it into a clinical context and tell the clinician, this is what it is. And the clinician will make sense of it. He or she will also be helped by artificial intelligence at the back, which will tell that in this specific disease condition, evidence shows after going through thousands of papers at the back that this is the treatment to be given. So that's the era we are venturing into. Time is short. But I would say in the end, what are the cons? This all costs money. Technology costs money. And if we are to get better technology, if we are to get better diagnosis, if we are to get precision medicine, if we are to target a specific cancer cell, it all costs money. We hope in the future that with increased volumes, the cost and the affordability, the cost would come down, affordability would increase. But just because we cannot afford it, technology is not going to stop. Technology will not be halted, and we have to be part of it. We have to participate in this. We have to take it forward. And it's up to the youngsters who are hearing me to do this, because we can only show the way. The hard work has to be done by you. Thank you all very much for giving me this opportunity. And I would like to share much more with the brilliant work that you do in your university. Keep up the good work, and thank you very much.
Thank you, sir, for enlightening us with your words, for emphasizing how the world is widely dependent on diagnostics and how advances in diagnosis is only going to help improve the healthcare scenario ahead. We look forward to having you with us sometime in the future. I would now like to call upon Dr. Samita Zadav, Madam, Deputy Director, Symbiosis Institute of Health Sciences, Symbiosis International University, to give the vote of thanks.
A graceful and warm morning to our most valued chief guest, our respected Honorable Chancellor, sir, our beloved Pro-Chancellor, ma'am, our graceful Vice Chancellor, Symbiosis International University, our dynamic Dean, Faculty of Health Sciences, the Director, Symbiosis School of Open and Distance Learning, worthy teachers, healthcare professionals, students, and most importantly, delegates who have gathered here. It is my privilege to have been asked to propose a vote of thanks on this occasion. I, on behalf of the entire fraternity of healthcare institutes under the umbrella of the Faculty of Health Sciences, Symbiosis International University, would begin by thanking the divine for showering blessings on all those who have gathered here. I would like to offer a prayer. Gurur Brahma, Gurur Vishnu, Gurur Devo, Maheshwara, Gurur Sakshat Parabrahma, Tasmai Shri Guruve Namaha. On my behalf, I extend a very hearty vote of thanks to Dr. Harsh Mahajan, President NATHEALTH, who spared time from his busy schedule to grace the occasion. I have had the opportunity to work with him extensively, and I'm thankful to him for wholeheartedly supporting the academic ventures of Symbiosis Institute of Health Sciences, especially in the space of medical technology. Even As I spoke with him in the morning, he humbly yet very enthusiastically stated, "How can I help you?" This enthusiasm is also by way of his son, Dr. Vidur Mahajan. Thank you, sirs. Here, we are fortunate to have been guided by our Chancellor, Dr. S.B. Muzumdar, who motivates us to be positive in the unprecedented COVID-19 pandemic and look at it as an opportunity to progress. It wouldn't have been possible without the guidance of our strong leadership in our power ladies, our Pro-Chancellor, Dr. Vidya Yerodekar, and Vice-Chancellor, Dr. Rajni Gupte, to hold such a mammoth conference on healthcare in times such as this, when the entire Pune city is in the line of fire. Events like this cannot happen overnight. So the wheels start rolling weeks ago and requires planning and bird's eye for detail. This is exemplarily displayed by our beloved Dean, Faculty of Health Sciences, Dr. Rajiv Yerodekar. It is always his passion to invite the best in the industry and academia to deliberate on current issues and trends, and by far, he has been successful in bringing a plethora of bigwigs on a single platform. We can't thank him enough. I learned from SSODL team that although many were taken under the double mutant variant, the dedicated team went on, undaunted, to bring SYMHEALTH 2021 to its fruition under the able leadership of their director, Dr. Abhay Saraf. I cannot thank everyone enough for their willingness and involvement to take on the work to completion, especially the faculty and staff from Symbiosis Institute of Health Sciences, Symbiosis College of Nursing, Symbiosis Medical College for Women, Symbiosis University Hospital and Research Center, the Symbiosis School for Open and Distance Learning. Here, I would specially like to thank Director, Symbiosis Institute of Technology, Director, Symbiosis Institute of Media and Communication, our anchors, speakers, students of SSODL, and the students of healthcare programs across SIU. A heartfelt show of gratitude to the people who have been the backbone of the event. Of course, I'm talking about the Central IT Department of SIU. We also thank the associate partners, press, and the electronic media and our sponsors for their support, and a big thank you to the delegates who have enthusiastically logged in since morning for their participation from within the country and from across the international borders. Once again, I thank you all for a cordial cooperation and wish the conference a great success. I would hence like to conclude the inaugural ceremony of SYMHEALTH 2021 conference.